Good, Sue. All right, good morning, everyone. Thank you for joining us today. If I have not met you already, my name is Marla Gordon. I'm the Director of Clinical Services here at Kendal at Home, and we appreciate you joining us today to hear Dr. Karen Kansas, a Senior Audiologist with the Cleveland Hearing and Speech Center, talk a little bit more about how to encourage a loved one to improve their hearing. And we were just chatting that we both have family members that need to listen to this presentation today. So we appreciate you being here. And if you wouldn't mind sharing a little bit about your background before you get started, and
Sure.
I'll get out of the way. But if you need me, I'll be in the background here.
All right. Well, thank you so much for having me this morning. So I am an audiologist at Cleveland Hearing and Speech Center. I've been practicing for 24 years now. I went to Ohio State and then later got my doctoral degree through A.T. Still University. And I Cleveland Hearing and Speech Center. Cleveland Hearing and Speech Center is a nonprofit organization. It's a community-based hearing and speech clinic. So we do hearing services, so audiology services, hearing testing, hearing aids, educational audiology services. So we go into the schools to help kids with hearing loss in the schools. We have speech therapy services for children and adults. We also have community services for the deaf and hard of hearing, which provides sign language interpreting for people and also case management for people who are deaf or hard of hearing. And we are celebrating our 100th anniversary this year. So that's kind of a big deal. Unfortunately, we had to cancel our benefit recently because of all the rise in COVID numbers, but we'll be back at it next year, I'm sure. So I'm happy to be here this morning to talk about how to encourage a loved one to improve their hearing. Typically I'm on this side of this presentation, like I'm giving the presentation, and it was really interesting to me last night. I attended a presentation put on by our county library. So it's kind of interesting to be on the receiving end of listening to a presentation through Zoom. But the topic was 6 Wives of Henry VIII, which was really interesting to learn about court life back then. But the presenter wore a crown, and I was really kind of jealous of her crown, and I don't have a fun crown to wear today. So I thought that would make the presentation way more fun. But this morning we were talking about how to encourage a loved one to improve their hearing. The reason why we came up with this topic and why we felt this topic was important is because we know that sometimes people are in denial about their hearing loss. You know, a lot of times people will come in perhaps for an appointment and say, I don't have any, like, I'm here because this person wants me. I'm here because my daughter wants me here. I'm here because my wife wants me here. I'm here because my husband wants me here. I hear just fine. I don't have any difficulty hearing. I'm here because of this other person. And so we know that sometimes people don't want to recognize that they have a hearing loss. So these are some strategies that if you have a family member, a loved one, a friend, that you're concerned that they're not hearing well, that these are some strategies that you can use to kind of perhaps convince them that they should go get their hearing tested at least. So common things that we hear as audiologists when a person comes in, they'll say, oh, I'm not having any difficulty hearing. It's just that other people are mumbling, or she has the TV turned down too low, and that's why I can't hear it. Or I can't understand my grandkids because they talk too fast. Or, well, you're just not speaking clearly. You need to speak more clearly. I'd be fine if you just spoke more clearly. So we know that sometimes the person thinks that perhaps it's other people that are the reason for them having difficulty or why they don't understand all the time. So it's really important then that we kind of have to shift their thinking and shift their point of view from maybe I'm having a hard time understanding, and that's because it's something that you're doing. It's your problem. You're talking too fast. You're not speaking clearly. You've done something, and that's preventing me from hearing you. And kind of get that shift to I'm having a hard time understanding you, and that's because I'm not hearing very well. So kind of getting that shift to put that ownership on them, the difficulty with their hearing. And this can be really difficult to do. And like I said, these are the strategies that you can kind of to help with moving a person along that continuum until they kind of say, yeah, I know I'm having difficulty. I need to do something about it. So we know as far as hearing loss is concerned, There are about 48 million people in this country who have a hearing loss, and it affects about 2/3 of the population that are aged 70 years or older. So we know that it is more prevalent amongst people as they get older. Unfortunately, only about 25% of people with hearing loss actually seek treatment for their hearing loss. So the majority of people with hearing loss don't do anything about it. So they are just living with that hearing loss, which, why is that a big deal? Or is it a big deal? And it turns out that it is. And I'm not just saying that because I'm an audiologist. We also know that on average, a person with hearing loss waits about 7 years to actually seek treatment for their hearing loss. So from the time that they first perhaps begin to think, oh, maybe I'm having difficulty hearing, it takes them about 7 years to do anything about it. So there's a long period of time where they're just kind of living with this hearing loss. So why is that a big deal? Several years ago, the National Council on Aging actually surveyed thousands of people in this country who had hearing loss. A group of the people had untreated hearing loss, meaning that they were just living with their hearing loss. They weren't wearing hearing aids, versus the other group was treated hearing loss. They were wearing hearing aids. And they had to answer a bunch of questions about their hearing. And what they found was that people with untreated hearing loss, who just had a hearing loss, just living with it, not doing anything about it, reported more episodes of sadness and depression. They reported they were worrying more, had higher levels of anxiety. They reported episodes of paranoia. They reported that, compared to the group with the treated hearing loss, they had less social activity, so they weren't as engaged with their family and friends socially. And they reported more emotional turmoil and insecurity. So you can see there are some really negative side effects of not treating this hearing loss. Versus people with treated hearing loss reported better relationships with their families. They had better feelings about themselves. They had improved mental health and greater independence and security. So obviously some really positive side effects to treating that hearing loss. So there really are some social emotional side effects to hearing loss. And you can see that seeking treatment for hearing loss really does have some positive effects. We also know that hearing loss is related to other medical diseases and medical processes. So your ears and hearing are not just kind of an island of themselves. They are related to other body systems. So we're finding now that there is a relationship between cognitive ability and hearing loss, so dementia and hearing loss. So people with hearing loss are significantly more likely to develop dementia than those who retain their hearing. And they don't know exactly what that relationship is. So there's some thoughts that perhaps when a person has a hearing loss, they have to put more work into listening and understanding what people are saying. So they're kind of putting more brain power into understanding a conversation. And that might pull those cognitive resources away from other tasks. That's one theory. Another is that the hearing loss may just actually change how the brain functions. It changes those brain pathways. And because the brain is changing, that could be why there's dementia also. We also know that there is a relationship with hearing loss and your social activity. So a lot of times people who have hearing loss start to withdraw from situations socially, but we also know that less social interaction can lead, or that there's a relationship there with dementia also when you're not as involved socially. It's really important to maintain those social connections. We know that there's a relationship with cardiovascular disease. People with a low frequency hearing loss are considered at risk for cardiovascular events. So maybe the low frequency hearing loss might be a little bit of a precursor to someone having some heart issues. We know the hearing loss and tinnitus are related. Up to 90% of people with tinnitus have some type of hearing loss. One theory is that the tinnitus is like a ringing or a buzzing noise that you can hear in your ear or in your head, but other people can't hear. So it's not an external sound, it's an internal sound. One theory is that it's our brain that's doing the hearing. And the brain is accustomed to receiving a certain amount of sound. But if a person has a hearing loss, the brain is no longer getting that auditory input. So it starts to make a sound of its own to fill in that gap. So it's one theory of why people with hearing loss have tinnitus. There's a relationship with hypertension. High blood pressure could be an accelerating factor in hearing loss. We know that there's a relationship with people who smoke. Current smokers have a greater risk of having hearing loss. I mentioned the whole isolation issue when I talked about dementia, but untreated hearing loss can lead to less social interactions, which can lead to social isolation, contribute to anxiety, depression, and cognitive decline. So we saw that before when I was talking about the effects of untreated hearing loss, that people were reporting more anxiety and more frustration and more social isolation. We know there's a relationship between diabetes and hearing loss, that hearing loss is twice as common in people with diabetes compared to people without diabetes. Relationship with obesity, the higher body mass index and larger waist circumference are associated with a higher risk for hearing loss in women. We know there are certain medications that can affect the ears and affect your hearing, so they can be poisonous to the inner ear organ and cause hearing loss. And we know that people with hearing loss have more issues with falling, and that might be a safety issue. The reason being is that when a person has a hearing loss, they're not hearing the sounds around them very well, so they don't have a good awareness of their surroundings. So what may happen is that someone may approach them, or something may approach them, and they may not hear that person approaching or hear whatever that sound is until it's really, really close, and then it startles them, and then you kind of lose your balance and you may fall. So that's that relationship. So hearing loss, we know that it's really important to get treated for your hearing loss. And we also know that if there are any other medical issues going on, that they could be related to your hearing also. So it's important to get your hearing tested if you have any these other medical conditions. So if you are concerned that someone is having difficulty hearing, we have some strategies that you can use to perhaps convince them that they should get their hearing tested to find out what's going on with their hearing. First thing is you can suggest they get their hearing screened. So before COVID, what I would have recommended is that if there was a local health fair, a lot of times at the health fairs, they have someone there doing hearing screenings. And so you go into a room and put the headphones on, you can listen to the different sounds. And that would kind of just give you a general idea of how the person's hearing. A screening doesn't really tell you, it tells you whether the hearing is normal or not normal. If you don't pass the hearing screening, it doesn't tell you exactly how you're hearing, but it's just that initial stage to kind of say, is everything good? Or do you need to have this looked at further? Now, there's not as many health fairs or in-person health fairs around, so this is not quite as easy to do. But I do have another suggestion, and that is we actually have a screener on our website. Let me see if I can get out of this. So let's see. If you go to Cleveland Hearing and Speech Center's website, which is chsc.org, and then in this little blue banner here, if we click on hearing aids, and it'll take just a second. If we scroll down a little bit, you can see this free online hearing screening, and we can click here. And it is actually, it says 10 minutes. I don't know that it takes that long, but you can get started with this, and you actually put headphones on, so you can wear earbuds or some other type of headphone that's plugged into your computer, and then it'll start to play some sound. So you set your volume at a certain level, you make sure you're in a quiet room. If the headphones have noise canceling, you turn that off, but then you can start to hear some sounds, and you can say whether you hear the sound or not. So you play the little sound and you adjust the volume until you can hear the sound or not. Okay. So that's a really easy way, kind of a low pressure way of doing a screening. It can be done in the comfort of your own home. no one necessarily has to know the results of that screening, but kind of so a low stress way of finding out, like, do you think, should the hearing be checked or not? Oh, and I still hear that sound in my headphones. I don't know if you guys can hear that or not, but we'll just close that. So that's one thing to get your hearing screened. Another suggestion is to schedule back-to-back hearing tests. So perhaps that person does not really want to go in to have their hearing tested, but if you schedule an appointment for that person and yourself also, kind of under the guise of, I've never had my hearing tested before, or, I wonder what my hearing is like. Like sometimes I don't hear very well. Let's both go together to have our hearing tested. That way it's not just something that they're going and doing by themselves. You're both going together, you can find out the results. The really nice thing about this also is that there's another person to listen to the results. So we always encourage a loved one to come in with an appointment. Even during these COVID times, we still allow a loved one to come back, or a friend, family member to come back with a person, because we're working with people with hearing loss. We know even with people with good hearing, when you go over results, they only understand about, or only remember about 50% of what is being said. So it's nice to have another set of ears there to listen to the results or to listen to the recommendations to make sure everyone's on the same page. So this allows then somebody else to be in the appointment to kind of hear what's going on. So scheduling back-to-back tests just is a little bit, like I said, a less pressure situation, because they're not the only person going through this and the focus is entirely on them. Another suggestion is to speak up, obviously doing that kindly. So I actually had a patient in my office yesterday who insisted that she had absolutely no difficulty with hearing. She feels like she hears perfectly fine, but both her daughter and myself were literally shouting in order for her to hear us. And at the end of the appointment, my throat was sore, and the daughter said, yep, every time I see her, I get a sore throat afterwards because we're just shouting in order to hear her. But she thinks she's hearing okay because everyone else is making an accommodation for her. Everyone else is speaking up. So she feels, hey, my hearing's great. And once again, in a nice, respectful way, let them know, I'm raising my voice in order for you to hear me. I'm not speaking at a normal level. This is actually really hurting me, like hurting my throat. And it's very, it's hard on me to raise my voice like this. And I don't want to shout at you when I'm talking to you for you to hear me. Or perhaps if the TV volume's up, you can say, I could hear this about the TV out in the hallway as I was knocking on your door. That actually, I had another patient in this week who said he was so excited to get his hearing aids because the other day, one of his neighbors knocked on his door and asked him to turn his television down. And he didn't realize that his TV volume was up so high. And he felt kind of embarrassed that his neighbor was knocking on his door, asking him to turn his television down. So, talking about like this volume's kind of high, like I can hear it all the way out in the hallway. Perhaps if you're out in public, if they are struggling or asking people to repeat, you can kind of say like, I really think we should get your hearing checked. I noticed that the other day when we were at this restaurant, you had to ask the waitress a couple times what she said. Perhaps, or you misunderstood this one thing. You thought you asked her, if she said, do you want ranch dressing? And you said yes, but you really wanted French because you misunderstood it. So just kind of pointing out when they're having difficulty, like I said, nicely, but pointing out that they're maybe having difficulty hearing. And just let them know, like I said, that if you're raising your voice, that you don't want to shout at them or feel like you're shouting at them or yelling at them when they talk to you. You just want to talk in a normal voice, and that you don't want to feel like you're yelling at them when you talk to them. But because they have to talk so loudly, they feel like they're yelling. Another thing to consider is, the longer you wait to have your hearing loss treated, the harder it is to adjust to that treatment process. So, we actually hear with our brains, and the brain is used to hearing certain sounds, but if you go for a long time period without hearing certain sounds, if you get hearing aids and all of a sudden can hear those sounds again, it might be really difficult to adjust to those sounds again. you have a lot of patients who will say, well, I can hear that clock ticking, or I put my coat on and I can hear the rustling of my coat. We take those sounds for granted. We hear those sounds, but don't really pay attention to them at all because they're not important. But for someone who's not heard those sounds for a long time period, the brain pays attention to all those new sounds that they're hearing. So it is a more difficult adjustment process. When you get hearing back, the longer you've gone without being able to hear certain sounds, because the brain isn't used to hearing those sounds anymore. And it does take a while. It does take a while to get adjusted to wearing hearing aids. It brings in sounds that you haven't heard, especially your own voice, chewing sounds, even things like the toilet flushing or water running. Like a lot of people with hearing loss can't hear those sounds. And then the hearing aids, all of a sudden they hear them again. But the longer they go without being able to hear those environmental sounds, the harder it is to adjust to them. So they might think, well, I don't want to go get my hearing tested because that person just wants to sell me something. So what I say to that is that as an audiologist, I'm not in the business of selling things. I'm in the business of helping people hear better. Like that's my job. My job is to help someone hear better. Unfortunately, I can't get them to hear normally or perfectly, but I can get them to hear better. So that is my job, whatever that is. So perhaps it's talking to someone about using good communication skills. If I have someone who says, I hear pretty well, except for when my wife is in the other room, I can't hear her from another room. Well, you know what, like that, then what you need to do there is kind of change your situation. Be in the same room as the person that you're talking to. Get the person's attention first before you talk to them or talk face to face. Maybe if you're having difficulty on the phone, it means getting an amplified phone or a captioned phone so you can hear on that situation. So it's not always hearing aids. A lot of times it's hearing aids is the answer, but we really want to make sure that we find whatever strategies that you can use to help a person hear better, or whatever devices they can use to help them hear better. And we really take a lot of time kind of getting to know what different listening environments the person is in, so we can tailor their recommendations for what they can do about their hearing to their specific lifestyle. So someone who is primarily in quiet environments, so they're at home, they're watching television, maybe once every couple of weeks, some family comes over to see them. Their listening environments, their listening needs are very different, perhaps from someone who is going to the theater and going out to dinner and breakfast with friends, or maybe is going to meetings or serving on committees. They have a different listening needs. So we try to tailor our recommendation based on those situations and based on the person's lifestyle. So just remember that an audiologist's job is to help you hear better. That's why we asked you where you're having difficulty hearing, because if we do something like hearing aids, we want to come back to those situations and say, okay, I know when you first came in, you told me that your TV volume was up really high. So now that you're wearing hearing aids, how's that TV volume? How are you doing with hearing the TV? Or if you're having difficulty hearing on the phone, okay, let's do something about it. And now how are things going? We kind of want to circle back to that to make sure that we're meeting your needs and addressing those issues that you're having with your hearing. And if someone needs hearing aids, they may not be able to afford them or think that they can't afford hearing aids. And that I understand that this is a very real concern. And it's actually one of the reasons why I really enjoy working at Cleveland Hearing and Speech Center. Because we're a nonprofit, we have a lot of options available to help people get hearing aids. So we have grant funding that helps people get hearing aids, and we take a lot of different insurance plans. So really, I think we have a lot of options available that can be really affordable. And so we don't have to necessarily ever turn people away. So things to consider is that there are a lot of Medicare Advantage plans now that do cover hearing aids. That is something that has really taken off in the past few years, are these Medicare Advantage plans that have other benefits, including hearing aids and hearing services that traditional Medicare does not cover. So that's an option for a lot of people. Ohio Medicaid is an insurance that does cover hearing aids for adults in the state. I mentioned that Cleveland Hearing and Speech Center has some funding for people who can't afford hearing aids. That's our audiology patient assistance program. We have grant funding to help people who can't afford hearing aids, who also don't have an insurance benefit for hearing aids. So they have no other way of getting hearing aids. We can use that grant funding to help them get hearing aids at a significantly reduced cost. So, I mean, a lot of our patients through that program are only paying a couple $100s for hearing aids. So that has really allowed and kind of opened up the door for people who didn't have any options previously. And there's also private health insurance plans that may cover hearing aids also. A person may be concerned about wearing hearing aids because they'll think that then people will know they have a hearing loss, or that they feel that the hearing aids will make them look old. And I think we all think of ourselves as being whatever age, 20s, 30s, whatever it is. But it's kind of a reminder that, oh, I'm getting older and I'm not hearing very well. But yet one comeback to that is, if a person is struggling to hear and they're asking for repetition frequently, or if they are answering questions inappropriately because they misunderstood what was being said, or if they are not really responding in a conversation the way you would expect. So maybe everyone's laughing and they're not laughing, or they're laughing and not everyone else is because they misunderstood what was being said. People notice that. So people know when someone is having a difficult time hearing. So it is noticeable having an untreated hearing loss. Plus, we know that there's a lot of hearing aid styles now that actually aren't very noticeable, and people are really quite surprised. So you can see here, there is on both of these pictures, there's actually a piece that goes behind the ear that you can see a little bit on the picture on the right-hand side, but not on this one here. And there's a little wire that comes down that goes into the ear canal. So even people with really short hair from the front or from the side, most people don't notice their hearing aids. Perhaps from behind, they may see them if they have really short hair. If they have any hair behind the ear, though, it's typically hidden. So there are a lot of, there are some options now that are really comfortable hearing, physically comfortable hearing aids that kind of blend in and are not as noticeable. So there are some options for people. And that brings me to the conclusion of my presentation. But it's really, like I said, it's really important that if you suspect that someone has a hearing loss, that they do a hearing screening, get their hearing tested, kind of start that ball rolling, because we know that untreated hearing loss really, as I said, has those negative side effects. So anything you can do to help encourage that person to schedule an appointment to have their hearing checked is a great idea.
Thank you so much, Karen. See, there is a question. Let me pull this up. From one of our care coordinators, who reluctantly got hearing aids and is having difficulty with adjustment. What can people expect for a practice's willingness to provide follow-up appointments for fine-tuning in the future?
So when you get hearing aids, as I mentioned, there is an adjustment process. The longer you've gone with the hearing loss, the harder that adjustment process is. It takes people generally about a month up to or 1 to 2 months to really get adjusted to wearing their hearing aids. So when I'm fitting hearing aids, I really let people know the more you wear the hearing aids, the quicker that adjustment process will go. The brain needs to get used to all those new sounds that are coming in. So I encourage people to try to wear their hearing aids all day long, or at least tell people that your goal is that you're wearing the hearing aids all day long. Sometimes they need to gradually build up to that. So maybe wear them for a few hours one day, a little bit longer the next day, and kind of gradually build up. Their goal is that they're wearing the hearing aids all day long, taking the hearing aids out at night. Other adjustment strategies are starting with the hearing aids first, wearing them in quiet environments. So wearing them when you're at home, watching television, talking to 1 or 2 other people that you're familiar with, and then kind of going into more difficult listening environments. So, when you go to the grocery store or in a larger group of people or at a noisy place like a restaurant or a bigger family gathering. As I said, it typically takes about a month. They might have difficulty adjusting to their own voice. Also, their voice is going to sound different and louder to them than what they're accustomed to. So for that, I typically recommend that people grab something to read and read out loud for 10 or 15 minutes a day. So they have an uninterrupted time where all they're doing is listening to their own voice. Now, as far as how their relationship with their provider, with the person who's providing them with the hearing aids, there's typically a return or a trial period with the hearing aids. In the state of Ohio, it's required that it's a 30-day trial period. So you have 30 days from when you receive the hearing aids to decide if you want to keep them or not. There are some Medicare Advantage plans that actually give you longer time than that. So you might have up to 45 or 60 days. And it's because of that adjustment process. We know that it takes some time to get adjusted to wearing the hearing aids. Typically during that trial period, you should be seen for follow-up visits with your provider. So we typically see people about 2 weeks after that first visit to kind of check in and see how things are going. If everything is going well at that visit, then we kind of play it by ear. If everything's going well, then we might say, okay, let's come back in 6 months and see how things are going. If things are not going well, then we're going to schedule another appointment to come back in a couple of weeks to see. And then you make whatever adjustments we need to make. Typically, when we are fitting hearing aids, we are doing testing to make sure the hearing aids are set appropriately. Sometimes that appropriate level is a little too loud for a person. It's like their ideal volume that the hearing aid should be set at. So we purposely set hearing aids a little bit softer in the beginning just to kind of help with that adjustment process. So it's not quite as big of a difference or as a jarring difference between going from really not hearing well to, oh my gosh, I'm hearing all these sounds with my hearing aids. So, I mean, there should be some follow-up appointments with the provider where you can make adjustments. It's great if the person can come back with feedback and say, I was able to hear this really well, but I was not able to hear well in this situation, or this was too loud, this was too soft, because that will kind of help the audiologist make some adjustments to how the hearing needs are set to hopefully kind of meet those needs.
I love that online screening tool.
Oh, good.
Pardon me. Definitely going to have my father give that a try this weekend. But what a losing my voice, I apologize. What a non-threatening way to take a look and see if you feel that there's an initial hearing deficit, but you don't want anybody to know that.
Exactly. Right.
So.
Yeah. Low pressure.
Well, very good. I don't see any other questions coming through, but I do want to remind everyone that we have several other pre-recorded sessions regarding different types of hearing aids and payment for hearing aids and things that have been discussed in the past from Cleveland Hearing and Speech Center as well. So please, if you haven't had the opportunity to attend those events, take a look at those pre-recorded informational events as well. And we appreciate your time today. And we have a thankful, all of us, I think, have a parent that we need to gently nudge. It sounds like we're starting to notice those deficits. So.
Yeah, I said the same thing about my dad. There's times I'm like, oh gosh, like you should be hearing well. Your daughter's an audiologist, so there's no excuse.
We see it on the flip end too, especially in our care coordinations. We don't want hearing deficits to be misconstrued for cognitive deficits, and sometimes that's what can happen. And even though hearing is kind of a taboo subject for many, it's much more that taboo to talk about cognitive impairments and possibility of dementia and things. So, if you're picking the first thing to start with, looking at that hearing deficit first and seeing how that might be contributing to not necessarily a memory deficit, but an interpreted memory deficit for sure.
Right.
So someone else is saying depression as well, right? It can kind of mask that too.
Yes. Oh, absolutely. Because what happens is a person if they have hearing loss, they don't find joy in social situations. They go to a social situation, they either have to keep asking someone to repeat, or they misunderstand what someone says, or they're not really following the conversation, and they find or they may think it's just easier for me to stay home and not go to that activity. And then, they don't have that social interaction anymore. So it's like I said, it has other negative side effects.
Absolutely. Well, thank you for all the great information. We appreciate it. And it's great information for our care coordinators too, to help pass along and encourage our members to seek some further assessments anyhow and go from there. So thank you so much for being with us today.
Thanks for having me.
Great day. All right. Thank you, everyone. Take care.
Bye.
Bye-bye.